Now, several universities have approved mandatory vaccination. This is part of an attempt to curb the spread of the coronavirus. A University of Western Cape employee alleges that workers were turned away from campus after failing to produce vaccine certificates. But the complainant claims this is unfair and says no clear communication had been given, especially for those awaiting exemption decisions. So let's find out how this can be tackled. From National Tertiary Education Union General Secretary and CEO Grant Abbott. Grant, thank you for your time and good morning to you. I suppose let's start with the case study before, talking about what the remedies of the situation could look like. I mean, we're looking at an employee of UWC who says he was not aware that a decision had been finalized on non-entry should you not be able to produce a COVID certificate. It's not just him, it's other employees as well, but it seems as pending a final decision because the exemption cases pertaining to this particular decision. What do we make of this in terms of how the university has handled this with its employees?
Good morning, Tumelo, and good morning to the viewers. Thanks for having me on. I think it's a very interesting case because what we need to do is we need to go down and drill down into the very fundamentals of this whole issue of co-determination and cooperation between all stakeholders at the university. The first thing we would want to know is what was the kind of communication strategy that came out in the first place? What were they communicating to staff members at that university, if at all? And had they gone through the proper processes? The regulations require that there must be a risk assessment. That risk assessment must involve consultation with stakeholders, which are trade unions, and the process that there is a exemptions committee or a process for exemptions, that must also be outlined. And in this case, it seems to be, and that's just purely based on the information that you've mentioned, is we don't know exactly what was fully communicated or not. And unfortunately, I have to say that it seems like we're moving into this draconian space, for lack of a better word, where university managements do take these decisions rather unilaterally and look at the process of consultation as more of a checkbox exercise, something they have to do just to get through the process. And that is becoming more and more problematic. So I think those are the kind of questions we would need to ask and specifically find out what processes they went through, and would have to ask the university for proof that they did the full consultation, risk assessment, and are they looking at proper and valid alternative accommodation for people who can't get vaccinated or choose not to get vaccinated.
Right. And I'm glad you made that point, because my next question was going to be around what are the consequences then for staff members? UWC is not the only university we know that has introduced or is planning at least to introduce mandatory vaccines. For those staff members who choose not to be vaccinated, what lies ahead for them? Because it seems from the merits of this case, just understanding where the UWC employee is coming from who chooses not to be named, it seems that they fear for their jobs or what will the likelihood of what would happen next should they not be able to produce this vaccine report.
Yeah. So I think that is exactly goes to the heart of what we're saying as NTEU, is that there is still a lot of fear and uncertainty around this process. And one of the things that helps us navigate through those fears and uncertainty is when stakeholders and unions and unions who represent employees are given a voice at the table to discuss these things and to have proper, meaningful consultations. And that is a requirement that's within the regulations. That being that there must be a proper risk assessment at each workplace. I think, let me say this, is that we as NTEU strongly encourage every single person to get vaccinated. We know that vaccines work to reduce severe conditions. and greatly reduce the risk of death. So we know that they are good and they are the best weapon that we have at the moment. But that doesn't mean that management structures can wake up one morning and decide that they are just now going to implement that. There has to be an assessment of the workplace, each and every single workplace, and reasonable accommodation for those who have legitimate grounds for why they can't get vaccinated. Things like religious grounds and medical grounds. Those have to be done with credibility. And again, like I said, they can't just be tick box exercises. We need to get back to the table. We need to be talking to one another rather than at one another. And we can't just allow just a blanket approach across the board. We certainly would not be in favor of anything that says that across the board, all universities or the whole sector must implement mandatory vaccinations. I don't think that's wise or smart at all. In fact, I think that would be quite draconian and would go against the spirit of what the regulations talk about when they talk about a risk assessment at each workplace. And the reason for that is that each workplace has its unique challenges, and each campus has its unique set of challenges, even within the geographical space that they are. There could be a university in a small town with a terrible healthcare system, and we would understand that they would need to implement that. But we would need to properly interrogate what are the alternative options that are available. The drastic consequences of job losses is something we simply can't just merely accept, and that must be an absolute last resort. That once everything else has been considered, there is no other option. So it can't be a go-to. It can't be a stick that is used in trying to implement such a policy.
Well, we'll leave it there, and I appreciate you speaking to us this morning. National Tertiary Education Union General Secretary and CEO Grant Abbott, thank you so much for your time.